Active immunity is an adaptive process that allows the body to make antibodies in response to the entry of antigens into the body. Passive immunity develops when antibodies that are created by another human or animal are transferred to the client. Active natural immunity develops when the body produces antibodies in response to exposure to a live pathogen that enters the body naturally. Active artificial immunity develops when a vaccine is given and the body produces antibodies in response to exposure to a killed or attenuated virus. Passive natural immunity occurs when antibodies are passed from the mother to the fetus or newborn through the placenta or breast milk. Passive artificial immunity occurs after antibodies in the form of immune globulins are administered to an individual who requires immediate protection where exposure has already occurred, such as following a bite from a poisonous snake or an animal who has rabies. The Tdap vaccine protects against tetanus, diphtheria, and acellular pertussis, also known as whooping cough. TD only protects against tetanus and diphtheria. You should receive a booster every 10 years, but it can be given incidentally every 5 years. For adults 19 and older who did not receive a dose of Tdap previously, substitute 1 dose with Tdap. Pregnant women should receive the vaccine between 27 and 36 weeks gestation. Pregnant women should get Tdap vaccine with each pregnancy to protect the fetus from pertussis. The MMR vaccine protects against measles, mumps, and rubella. Adults should receive 1 or 2 doses between the ages of 19 and 49 if they lack documentation of immunization or prior infection or a lab proof of immunity. It's contraindicated during pregnancy, and you should take precaution if a transfusion with blood products containing antibodies has been administered within the prior 11 months, as well as simultaneous tuberculin skin testing. The varicella vaccine protects against chickenpox. You give 2 doses to adults who do not have evidence of a previous infection. A second dose should be given to adults who have had only 1 previous dose. It's contraindicated during pregnancy, and a pregnant woman needing protection against varicella should wait until the postpartum period for immunization. Take precaution if a transfusion with blood products containing antibodies has been administered within the prior 11 months, as well as treatment with antiviral medications within 24 hours prior to immunization, and you should avoid taking antivirals for 14 days following immunization. Extended use, which is 2 weeks or longer, of corticosteroids or other medications that affect the immune system, and cancer. The pneumococcal vaccine protects against pneumonia. There is PCV13 as well as PPSV23. Follow recommendations for administration to adults who are immunocompromised, have specific chronic diseases, smoke cigarettes, or live in long-term care facilities. It can be given from the age of 2 to 64 with a medical condition or a risk factor. 19 and older who smoke should receive the vaccine. For adults 65 years and older who have not been immunized with PCV13 or PPSV23, administer PCV13 first and then give PPSV23 in 6 to 12 months. Do not administer both during the same visit. For adults who received a dose of PPSV23 at age 65 or older, an additional dose is not indicated. It's contraindicated if there's been an anaphylactic reaction to any vaccine containing diphtheria toxoid. Take precaution with pregnancy. The hepatitis A vaccine should be given in 2 doses to high-risk individuals, and the doses should be given 6 months apart. 1 month after the first dose, 94 to 100% of adults and children develop a protective level of antibodies. Adults who receive the second dose have 100% protection after 1 month. The Hep B vaccine is given in 3 doses to high-risk people who lack completion of the series. There's 1 month between doses 1 and 2, 2 months between doses 2 and 3, and a minimum of 4 months between doses 1 and 3. The antibody duration of protection is 5 to 7 years. There are three types of influenza vaccines. The first is inactivated influenza vaccine, also known as IIV, and it's approved for clients who are pregnant, children, and patients with an egg allergy. The recombinant influenza vaccine, also known as RIV, is approved for adults 18 years and older, and it's contraindicated with an egg allergy. The live attenuated vaccine, known as LAIV, is given as a nasal spray, and it's indicated for adults under age 50 who are not pregnant or immunocompromised. Children 2 to 8 years may need a second dose. Avoid in a child or adolescent between the ages of 2 and 17 who are receiving aspirin or aspirin-containing products. This is also contraindicated with an egg allergy. The HPV vaccine prevents against HPV 6, 11, 16, 18, as well as HPV 31, 33, 45, 52, and 58. The only HPV vaccine available for use in the U.S. is the nine-valent vaccine, 9V HPV. It can be administered as young as age 9, but is recommended for ages 11 to 12 to get 2 doses given 6 to 12 months apart. Children who start the HPV vaccine series on or after their 15th birthday need 3 doses given over 6 months. In a 3-dose series, the second dose should be given 1 to 2 months after the first dose, and the third dose should be given 6 months after the first. The HPV vaccine is not indicated for anyone older than 26 years old, as it's only effective if given before exposure. The zoster and Shingrix vaccine protect against shingles. The Zostavax is the older vaccine of the two, and it's recommended as a one-time dose for all adults older than 60 years. It only reduces shingles outbreaks by 50%, but insurance will cover this vaccine. Shingrix is the newer vaccine, and it is recommended as 2 doses of recombinant vaccine to all adults age 50 and older. It reduces the shingles outbreak by 99%, but insurance may not pay for this vaccine.